My name is Perez and we're going to talk about antibiotics. Nowadays, people concerns about health is the main issue. A lot of people have questions about antibiotics. How do we use them and what do we use them for? Antibiotics are used to treat bacterial infections. They are ineffective against viral infections and most other infections. Antibiotics kill microorganisms or stop their reproduction, facilitating the elimination by the body's natural defenses. There are lots of classes of antibiotics, such as aminoglycosides, carbapenems, cephalosporins, fluoroquinolones, glycopeptides, and catalytes, macrolides, monobactamics, and penicillins, polypeptides, rifamycins, and sulfamides. Sometimes, combinations of antibiotics are required to treat the following conditions. 1. Serious infections, especially during the first day, when the sensitivity of the bacteria to the antibiotic is still unknown. 2. Certain infections, when the bacteria quickly offers resistance to the antibiotic. And 3. Certain infections when it's caused by more than one bacteria, and we have to administrate more than one antibiotic to fight against them. Bacteria, like other living things, undergo modifications over time in response to environmental changes. Thanks to the widespread and abusive use of antibiotics, bacteria are constantly exposed to these drugs, and although many of them die after being exposed to antibiotics, some of them become resistant to the pharmacological effects of these drugs. So we ask ourselves, what's the best way to treat this infection? Well, it all depends on the characteristics of the bacteria. For example, 50 years ago, Staphylococcus aureus was very sensitive to penicillin. But over time, some strains develop an enzyme capable of breaking down penicillin, which nullifies the whole drug's effectiveness. So, in this case, we wouldn't use penicillin as our first choice. We would use a certain combination of antibiotics, such as cefazolin or cefuroxime or clindamycin together. So, we can close this by saying, being in the doctor's position isn't as easy as it seems. For an infection, we can use different types of antibiotics. It's necessary to determine what type of bacteria is causing the infection in order to address it in different ways. For the right treatment, we must do different tests and have a wide panorama of the patient's health. Little details can make a much larger difference. For example, nowadays, many people are allergic to penicillin, and we must take this into account in order to prescribe a treatment harmless for a patient. There is no antibiotic better than other. They are just used in different infections based on their effectiveness.